we're back. Nothing really slowed down while we were gone, but we are back. And listen, we're talking about what's been going on for the last couple of years, and good points have been made that a lot of these issues were just exacerbated.
Right.
They weren't invented during the pandemic. It just really brought into sharp focus some of the flaws and fallacies in the education system. And those things just got really magnified during the pandemic. And I said I had a question for Dr. Redfield. We've already said, Dr. Redfield, that this pandemic's not over, correct?
Correct.
And Dr. Christakis, you and I were talking earlier before the show, as we come into winter, we could still see some spikes in this.
I expect we will. I mean, everyone would expect that, yeah.
And
Yes.
I'll ask you both, as physicians, are we likely in the near term, 2 to 5 years, to see another pandemic that is not necessarily just a derivative of this, but something that is independent, but of a similar magnitude?
I think, Dr. Phil, that's why it's so important that we really do an honest reflection on how unprepared we still are. I mean, I think if you just watch the monkeypox experience, once again, and that was approached more like an academic exercise rather than a public health response exercise. And so now we are going to have monkeypox with us for the rest of time. I think there's no doubt that we're going to have another pandemic. And I actually, I call it the Great Pandemic. And I don't say this lightly. When I went to be CDC director, one of the reasons I did it, I felt called as a virologist, and I think our nation's at great threat for what I'll call a bird flu pandemic. And I think we still are at great risk for that, and we're very unprepared in many different ways, and we need to get prepared. I've always said on my congressional testimonies that I believe the national security of the United States is much more threatened by the next pandemic than it is China, Russia, North Korea, and Iran, and we ought to prepare for it proportionally. So I think we're at great risk. And the problem with the bird flu pandemic, in a way, we were gifted with COVID, although it's terrible. We've lost over 1 million people. When I was briefed originally in February 2020, CDC told me that they expected we'd have 2.2 million people dead by September 2020. Now, luckily, that didn't happen, but we still had almost 200,000 people that lost their lives by then. But we're in for a great pandemic, and the bird flu pandemic's not going to have. It's going to have a much higher mortality rate, and it's not going to segregate between young and children and teenagers and young adults and midlife and old. It's going to have a mortality rate across the board. And whether that mortality rate's 5% or 10% or higher, it's going to be there. And that's why we have to be vigilant about getting prepared so that we can confront this pandemic in a much more effective way than we confronted this.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.